I'm Dr. Pam. We've talked a lot about menopause and perimenopause in our prior podcast, but today is about birth control. So it's for younger women. All the different options because it's very confusing. I'm going to break it into different categories, starting with barrier methods, which obviously are blocking the sperm from getting to the egg. And the number one barrier method that most people are familiar with are condoms. Condoms being one of the few that actually block your risk for getting a sexually transmitted infection, and the STIs are moving up in number. There's been a huge increase in sexually transmitted infections in the last couple of years: gonorrhea, syphilis, chlamydia, and I always worry about HPV as well. So we have to be very mindful of that. And if you have multiple partners, I don't care what method of birth control you're using, you really should use condoms as well so that you can prevent an STI. Condoms with perfect use, 97% effective, but that's, taking a risk because they do break on occasion. Reality use, the effectiveness is about 88%. And so, again, alone, not the best on its own, but great in combination with other methods. Other barrier methods are good old-fashioned diaphragm, which most women don't use, and cervical cap. You have to be able to put those inside the vagina and cover the cervix. Effectiveness of the diaphragm is about 88%, and the cervical cap is about 77%. And then there's also the over-the-counter sponge, which does have spermicide in it as well, and that is about 88% effective.